I'm Geoff Kane from the United States, Brattleboro, Vermont. What if everyone became more person-centered? My response to how can I be of help, how can we be of help, is for us to take the respect, empathy, non-judgment that we may use in our work and bring it everywhere else that we go. You may be doing this already. I'm inviting us all to be more deliberate about that. And I anticipate that in communities with more non-judgmental compassion that we apply to ourselves and to others, that things will get better. And if we bring it to all our conversations, the superficial, non-verbal and verbal interactions we have with everyone, then some of the things that are going on with harmful substance use and addiction will get better. Before COVID-19, it was terrible in the United States. It's even worse now. Estimates for earlier this year are 300 deaths per day in the United States. Show of hands, how many people agree with the statement on the slide that chemical substances can change the brain and change behavior? Unanimous. If we're looking to have more respect and understanding for people at the serious end of the spectrum with substance use disorders, people with addiction, it makes sense to understand what's going on with the neurobiology of behavior and the neurobiology of addiction. Normal and the sketch of the brain, cerebral cortex, awareness, intention, decision-making, the red circle, brainstem, limbic system, emotion, survival instincts, elements of muscle memory. It's normal for those emotional centers of the brain to cause behavior, bypassing decision-making and intention. Think of people flirting before they realize they're attracted to someone. Think of someone deciding that they don't need dessert and then they reach out and take it. That gets magnified with addiction. All the addictive substances produce subtle or dramatic surges of dopamine in the pleasure center, nucleus accumbens. That pleasure or relief from displeasure, a lot of people have trauma in their past, conditions, trains the primitive part of the brain to have sort of an additional survival intake, and that's more substance. So, young man addicted to heroin in treatment, when I was using, it was like my life depended on it. I sometimes liken the urgency that leads people to neglect their own health, neglect their own children, to the state I'm in if I've held my breath and I can't hold it any longer. I'm going to breathe and nothing else matters. A nurse said, it's really hard to judge someone for breathing. Can you agree with this statement? You wouldn't be here otherwise. What about the add-on? Toxic interpersonal relationships do damage. Positive interpersonal relationships are healing. And why not take that into a community where there's too much disrespect and indignity? Now, all this brain stuff that we have science about and know about and talk about interferes in a way with paying attention to other important determinants of disease. The poverty, income inequality, healthcare inequality, discrimination. Discrimination refers to racism, but more than that. In the United States, before COVID, there was 10 years or so of research data that indicated that binge drinking was increasing, not just among the disadvantaged minorities, but also among women and the elderly. And healthcare providers have often said, well, we don't deal with these social determinants of health. And we're talking about social determinants of ill health when we talk about these damaging socioeconomic issues. Here, let's talk about social determinants of better health that we can do in our relationships. But people looking at the ill health effects say, well, I'm a healthcare provider, I can't deal with that. Someone has to go upstream, and the people who control money and power locally and nationally, maybe they can do something about it. I'm not sure they're well disposed to do something about it. However, if we think of part of our health care forces as some journalists, some legislatures, and some filmmakers, there's more room to go. In communities, besides the social environment, the disrespect and judgments that happen, there are some structural factors beyond the socioeconomic ones, or including the socioeconomic ones. When substances are more readily available, they're more often be used. Some people progress to addiction. Some people make it out, some don't. And I worked in the South Bronx, storefront alcohol clinic. Within 1 block, there were 6 places you could buy alcohol. In the suburbs, you might have to go 6 miles to buy alcohol. So something's determining that distribution that could be changed. And the distinctions between prevention and treatment get blurry because easy access to substances, permissive attitudes towards using them, get people started, keep people going, get people in trouble. And also, if somebody's been in trouble, they get out of it, they're more likely to reinstitute use in those conditions. It's as if we're all traveling an individual path in our lives. And some are more inviting than others. Yet, on every path, there are social interactions and structural interactions that make it more or less likely someone's going to start using a substance. And some of those are more toxic. Some of them are more nurturing. So they protect people as they travel, or they make it more likely that they stop going towards substance use, or they make it likely that they get out of it afterwards. So bias and judgment of people who have addiction deters people from asking for help. They don't want to be disrespected by a healthcare provider, and they may just sort of suffer in silence. Everyone is at risk, and even I chose harmful substance use because substance use disorder implies a pattern or a sort of an ongoing exposure to something. But in America, maybe a young adult is anxious, has an injury, they want some relief, they go to a drug dealer and get a single pill. It looks like a brand name benzodiazepine. It looks like an branded opioid pain medicine. It's counterfeit. It has a lethal dose of fentanyl in it. They take it and their family is grieving. There's a tremendous human cost to all this. Not everyone is in tune with the human cost. However, if people don't care so much about that, maybe they care about the financial costs in the environment, where lost productivity, healthcare, and the care of orphans takes up a lot of resources. Susser presented this ecological diagram of the causation of health problems, and published in 1973. In 1973, there wasn't, even in medical circles, there wasn't a whole lot of interest in epidemiology and public health. People thought it was boring, and if they had to take it, they did grudgingly. Yet today, with the COVID pandemic, everybody's an epidemiologist and think in terms of their own vulnerability, how to protect that, what to do about whether it's a germ or in the environment or a chemical in the environment. There's still things about the environment that brings it to us, or we protect ourselves from it, social gatherings, for example. And people are being more careful about looking out for one another. And that fits with how person-centered care providers work with the individuals they work with. And I'm saying deliberately, let's take that everywhere we go. Now, there's a lot of cooperation in the world. There's also a lot of this. And sort of expression without connection, without true communication. And as humans, we are surrounded with so much detail. We have to think and communicate in categories. It becomes a problem when we identify with a particular category and then we encounter someone who's not in that category, and naturally enough, we tend to look down at them. Bias, which can lead to prejudice, discrimination. We can't make our use of categories go away. We can help ourselves and others to be more aware of the bias and be more consistent with non-judgment. In the addictions field, people have entrenched views about what's wrong with others and what to do about it. There's polarized harm reductionists and polarized abstinence-only people. The reality is most individuals are somewhere in between. Some really need a harm reduction approach. Some really need an abstinence emphasis if they're going to survive. And rather than providers come at it with their own views about what the person should do, much better to come at it with their dominant view is, who is this and what do they need? And to be person-centered in that approach. The science of motivational interviewing tells me that it's more important for me to not get in the way of someone who needs to make changes. So not to give them direction or lecture or argue or give them advice without permission, because that blocks them on their path to health. If I come alongside and have a conversation, perhaps make a double-sided reflection that gets them thinking about how their behavior isn't consistent with their values, that can help them to move along. Polarization, all too common. Polarization in politics, as you may have heard, is a problem in the United States. If you haven't encountered braver angels, family therapist William Doherty, University of Minnesota, took what worked in couples therapy and took it to polarized political groups, really red Republicans, really blue Democrats, and got them talking about what's the worst thing people say about you, why is that not true, and what's the kernel of truth in it. Enable them to have a conversation. Some of those conversations are still going on. I think the people vote differently, but at least they're talking with one another. And I think the time may be here for person-centered care to get more attention and have more impact, especially with kind of ambassadors in the field. I was a trainee in internal medicine and social medicine in the Bronx in 1972, and preceptors said, meet the patient where they are. Okay. Much later, I thought about where that must have come from. Well, Carl Rogers was influencing psychology and psychotherapy and psychiatry from the 1950s on. And also in general medical care, Michael and Enid Ballant in the UK started discussion groups of general practitioners on saying, who's got a case? Somebody would talk about struggling with an issue with patient care. And then the whole group would think about the patient and the provider. It was sort of a process group for helping the provider adapt to and adjust to the individuality of the patient. Sort of Rogers' work has been followed with the massive evidence in motivational interviewing that person-centeredness is a good idea. The developments in interpersonal neurobiology say the same thing. And in healthcare, there's a body of evidence that patient-centered or person-centered healthcare gets better outcomes, has better satisfaction, and it costs less money in the long run. So it's, I think the time may well have come to get more person-centered and to be, if there's disagreement, at least not to be disrespectful in the disagreements. You can sort of read some of the points, but person-centered care addresses the variability that exists. And it's the variability that exists that people with entrenched views have difficulty dealing with. Huge arguments about whether alcoholism is or is not a disease. Now, addiction is or not is not a disease. it's a health problem that's classified as a disease. It's a label. Diagnoses are no more than labels. And to treat them as a real thing is to ignore the people that we're working with. So descriptions and people are real, and descriptions respect them. Labels don't so much. Labels can be useful for scientific purposes and research classifications and mobilizing research funds, health insurance, and all that. And it sometimes reduces shame in the part of a person affected. Yet, if they take on their label like a career and live their label, that doesn't work out so well. Descriptions. Individual said, I have an unhealthy relationship with alcohol. I don't drink every day, yet when I do drink, I consume an inappropriate amount. Well, what do we need to know? No need to label that or classify it, just help the person abstain from alcohol. Accountability, being person-centered, is not absent accountability, though we don't have to be the one shaking our finger. We might point out that, well, I'm not going to hassle you about continuing to drink, but your liver might raise an objection. Nature can deliver consequences. The legal system can deliver consequences. Drug courts can be very motivating. They sort of set an expectation, and there's a consequence if it's not followed. Restorative justice. Well, you harm someone. We've got some things that we can call up, but the best thing is for you to go have a conversation with the person you harmed. Autonomy. Biomedical ethics tells me to respect autonomy. Motivational interviewing tells me if I care about good outcomes, I want to respect autonomy. As I do that in the atmosphere where I work now, where people have opioid use disorder, they're on a medication that I prescribe, buprenorphine, which can save their lives, continue their lives. Some of them may use some alcohol, some of them may use some cannabis. I don't want to make that use a reason for them to go off the medicine that's protecting their life. So I've had to adjust my expectations from what I might have thought in the 90s or the early 2000s to accommodate what's going on right now. And the funny thing is, the more I respect autonomy, the more responsibility individuals take about taking their risks and behavior into account. If I'm interested and curious and have a conversation with someone who's very different from me, my life gets more interesting. Conversations can take many forms, and it's how we go about it that makes the most difference. And there is use of legal and illegal drugs, heroin, cocaine, that exists in our communities without disorder. And I think we'll be hearing more about that. I sort of invite people who are doing that they be responsible about it and be careful that they don't involve others who are more vulnerable than they are, or inspire others to follow their pattern who may be more vulnerable than they are. I work in Brattleboro, Vermont. 12 to 13,000 people on the Connecticut River in southeastern Vermont. Had hippie communes, and cannabis was popular before it was medicalized and legalized. And there are groups in the town that for, I'm guessing, 5+ years, in response to the opioid crisis, have been having community conversations where it would feature stories of people in long-term recovery or early recovery, and also those of us around them, family members and law enforcement, and they'd be held in a theater, maybe with a documentary first, the art museum, fire station, library, and very moving, sometimes painful to listen to, generally respectful and modeling the kind of interaction that we would appreciate in relationships. And Carl Rogers is wonderful about using himself to make valid generalizations about people. I like to be heard. People get heard. It helps them in their journey. Theme of responsible use and no use. I've started thinking about people who are interested in using substances. If they back to the ecological model, it helps make clear that there's individual responsibility, professional responsibility, and community responsibility. With respect to use and non-use, part of the individual responsibility is if somebody decides that they are going to use, not to just do it. Yet it's like climbing a mountain or taking a hike on a mountain or a hike in the woods. What's the weather? What's the terrain? Have I ever done this before? How do I feel physically today? Emotionally today? Do I have any special needs? With substances, do I have a lot of trauma, adverse childhood experiences, or a family history of addiction and genetics that make me more vulnerable? If I'm going on a hike, do I have a bad knee or a bad ankle I have to worry about? And what can I take with me? Who's going along? If it's an opioid, is there Narcan? I mean, not all hikers take appropriate precautions. Not all substance users take appropriate precautions, yet it would be a good thing if they did. There's disagreement about even what recovery means. Lots of discussions of recovery emphasize abstinence. As I meet people who are in mature recoveries that I respect, it's about humility, honesty, and responsibility. I'll leave you with a comment. I'll leave this part of what we're doing with the comment. As you go forth, shining your light on yourselves and on others around you, it's okay to smile.